Let's now discuss triple burner 5, or the outer pass point, a Luo-Connecting point. Triple burner 5 is located to tune proximal to the dorsal wrist joint space, or the dorsal wrist crease, between the radius and the ulna. How to find triple burner 5? As the location of the dorsal wrist crease varies, the wrist joint space should be used for orientation instead. By moving the patient's wrist in a relaxed way, the joint space becomes more easily palpable. TB5 is located to tune proximal to the midpoint of the joint space in the depression midway between the radius and the ulna. Or using the creep method, with the palpating finger, slide with slight pressure from the dorsal aspect of the wrist joint in a proximal direction between the radius and the ulna until the finger is brought to a rest at TB5 by the increasing skin bulge building in front of it. Pericardium 6 is located opposite TB5 on the anterior aspect of the forearm. TB5 is needled vertically or obliquely, 0.5 to 1.5 tune. Caution should be exercised as movement of the hand or arm during needle retention may cause bending of the needle. For its actions and indications, TB5 expels wind and benefits the head and ears, clears heat, opens and regulates the Yang Wei. It also opens the channels and alleviates pain. For special features, TB5 is the Luo-Connecting point of the triple burner meridian. It's the opening or the master point of the Yang Wei, and it is the major point for expelling wind heat and analgesic point for the upper extremity. TB5 is a major point to release the exterior and expel wind heat. It must nearly always be used to expel wind heat when there are such symptoms as fever, sore throat, slight sweating, aversion to cold, and a floating rapid pulse. It is especially indicated in invasion of external wind heat when there is an earache. It can be used for the greater yang stage of the 6 stages, which is the wind heat type, or the defensive chi level of the 4 levels, and also for the lesser yang pattern within the 6-stage pattern identification of the gallbladder heat pattern of the 4-level pattern identification. It is the main point to regulate the lesser yang when the pathogenic factor is half in exterior and half in interior, with such symptoms as alternation of chills and fever, irritability, hypochondrial pain, bitter taste, blurred vision, and a wiry pulse. According to some sources, this point can actually expel all pathogenic factors, that is, wind, heat, cold, dampness, dryness, and fire. This point is also a major point for the treatment of painful obstruction syndrome of the arm, shoulder, and neck, and is indeed a general point for painful obstruction syndrome from wind. As it is the connecting point, it affects the whole area irrigated by the connecting channel and the muscles and sinews along the channel. TB5 benefits the ears and can be used whenever there is an ear infection from an invasion of exterior wind heat, or tinnitus and deafness from liver fire or liver yang rising. Finally, TB5 indirectly subdues liver yang rising because the triple burner connection with the gallbladder within the lesser yang, and is very much used as a distal point to treat migraine headaches on the temples from rising of liver yang. So to summarize its functions, this point expels wind heat in febrile diseases, aversion to cold, fever, earache, alternation of aversion to cold and aversion to heat. It also benefits the ears in tinnitus, deafness, earache, itching of ears, redness, pain, and swelling of the ear. It also clears heat in the head where there is redness, pain, swelling of the eyes, stiffness of the tongue, mouth ulcers, cracked lips, nosebleed, and mumps. It also subdues liver yang. There is headache, dizziness, one-sided headache, vertical headache, and neck ache. It also removes obstruction from the channel, which manifests with pain of the shoulder and neck, stiff neck, arm pain, contraction of the elbow and wrist pain, paralysis of arm, swelling and redness of arm, pain in the fingers with inability to grasp, and tremor of hand.